We are a nation of fat people. According to the website, everydayhealth.com, obesity rates have doubled since 1980. 70% of the population of Americans are classified as either overweight or obese. This is why we're number one in cases of diabetes and heart disease. Why are we so fat? Mostly due to our infatuation with sugar and processed foods. We're number one in sugar consumption in the world. We eat 126 grams a day, which is 10 times more than the recommended daily allowance of 11 grams. Americans' obsession with sugar and carbs not only causes adverse health effects for those who overindulge, it affects everyone in the form of higher healthcare costs and overcrowding of hospitals, emergency rooms, and doctor's offices. In my 15 years as a paramedic and now as a nursing student, I've seen firsthand what the effects of obesity and diabetes can do. About 10 years ago, I started researching health and fitness and nutrition and decided to apply these principles in my own life to try to maintain a healthier lifestyle. The majority of Americans either don't know how to or can't afford to make healthy choices when it comes to proper nutrition. We must educate the public, beginning in our schools, and we must hold the food and beverage industries accountable for their targeting of children in low-income communities with their advertising strategies. But every American is affected by our culture's obsession with sugar and processed food. So we should educate the public and hold those who perpetuate and profit off of it responsible. First, we're going to talk about the negative impact that too much sugar is having on our society, who is at risk, and who is largely responsible for it. The increased consumption of sugar has been linked to higher rates of diseases such as type 2 diabetes, heart disease, and even some cancers. The American Diabetic Association said that in 2002, 6.3% of the population had diabetes, and it is the sixth leading cause of death in the United States. A lot of these cases begin in childhood. In 2007, 23% of adolescents were either pre-diabetic or were diabetic, and that's up from just 9% in 1999. Most people get half of their daily calories from sugar in the form of sugary drinks, cakes, cookies, and other foods not considered sweet, such as ketchup and tomato sauce. A study conducted by the Journal of American Medical Association says anyone who gets more than a fourth of their calories from sugar has double the chances of getting heart disease, and that sugar consumption can decrease your white blood cells by 40% up to 5 hours after you consume it. The sugar and food industries are responsible for exacerbating the problem with ad strategies aimed at children in low-income communities. The food industry spent $1.8 billion in 2009 in advertising directed at children. Most of these ads promote sugary drink, cereal, sweet snacks, and fast food, which totaled approximately 91% of the advertising dollars that were spent. These ads are proven effective and have even been termed to have pester power due to their effect in causing kids to convince their parents to buy these things for them. The food and beverage companies have virtually unlimited access to children through ads that they have online and social media. But children aren't the only targeted audience of the food and beverage companies. Lower income areas, especially minorities, are also exposed to an endless bombardment of ads for filled foods, and drinks. Fernando Quintero, a communication strategist at Berkeley Media Studies, testified before the San Francisco Board of Supervisors that studies have shown that African American and Latino teens are exposed to twice as many ads for sugary drinks as their white counterparts. Studies also show that African American and Latino have a disproportionately higher rates of diabetes than whites. But race isn't the only factor. Studies have also shown that the disease is more prevalent in lower income areas and those with less education. While food and beverage companies make billions of dollars off their products, the American taxpayers are footing the bill for skyrocketing costs associated with treating illnesses, especially in lower income communities where a large portion of these people are enrolled in either state or federal Medicare or Medicaid programs. Now that we've discussed some of the damaging effects of high sugar diets, let's look at how, as a society, we can find a solution. Some of the solutions begin at the local level and range all the way up to the White House. As reported by Time.com, former First Lady Michelle Obama began an initiative entitled Let's Move back in 2010 designed to improve obesity rates and providing nutrition education for children and also encouraging physical activity. The USDA followed by mandating healthy options in school cafeterias and in vending machines. Some state and city governments have even went as far as to impose a sugar tax, requiring a higher tax on sugary drinks as a deterrent. And they have had some success with this. According to the website PLOS.com, which is a medical research website, said that sales did drop in those cities by 40%. Sugar companies also use creative wording and labels to try to convince consumers that the products that they're choosing are safe. Even though they may be full of sugar, they'll put things on the label like low fat to make them think that it's a healthy option. They will also list sugar under other names such as sucralose or high fructose corn syrup to attempt to trick the public into buying their products. What can we do to help the situation? We can educate ourselves, our family, and our children to avoid sugar-laden food and drink. We can encourage healthy options in our schools, and we can contact our local, state, and federal representatives to encourage them to combat the sugar and obesity epidemic by voting against the sugar and food industry's attempts to profit over public health. Now we've discussed the problem we're facing with obesity and chronic diseases, and some of the solutions offered at different levels. I hope you understand how serious the problem is, and how you can do your part to improve on it. As I said, the U.S. is the world leader in obesity and related illnesses. Everyone has a responsibility to do their part to make our society a healthier and happier one. Everyone here has either been directly or indirectly affected by obesity, either through a rise in healthcare or someone they know that has suffered diseases related to obesity. If we don't recognize the trajectory that we're on regarding health and our habits, then the well-being and readiness of our society will continue to decline. In an article in the New York Times said 2/3 of our prospective military recruits were ineligible for military service due to poor physical fitness. I challenge everyone to find a way where they can contribute either through educating yourselves or others, or contacting your government representative to encourage them to vote for healthy initiatives in the American public.